Welcome back to Lunch and Life with Sharon and Robin. This month we're talking about taking care of the women in our lives. With 4 weeks, we're going to unpack our lunch and get started. Are you ready, Sharon?
I am ready. Let's do
Let's
it.
do it.
Hi everyone, I'm Sharon Gelfand, functional and holistic nutritionist, author and speaker. I work with women over 40, get to the root of their most common health complaints with at-home testing and flexible food choices so they have more energy, less stress, and feel great again. And I'm here with my co-host, Robin.
I am Robin Joy Myers. I am a scientist, TEDx speaker, author, and fear strategist. And I help women fall in love with themselves so that they can embrace life's changes and find their true joy with trust and confidence.
Awesome. Well, I'm so excited about this month, Robin. We have a lot to unpack. As you said, it's helping the women in our lives, right? Whether it's brothers, listen to me, brothers. Whether it's
Others
brothers
can help.
who have the sisters and the mothers and the friends and the aunts and the girlfriends, everybody. So get us started.
Well, it's actually Breast Cancer Awareness Month, right? So there is a female in everyone's life somewhere. So it's really important that we have this awareness. And I think this month it's going to be huge. So this week, let's talk about really the background and lifestyle, right? I think if we could be more proactive and come from that angle of being proactive and not reactive, it would be a great start. So a lot of it, again, it comes into mindset and taking care of ourselves, right? We're also going to unpack each week. So we're going to unpack into what nutrition, and we're going to unpack into, how to take these actions and really advocate for ourselves, because that is something as women we don't necessarily do. So
Yeah.
Sometimes we need a help from a little push from a friend or a spouse or a partner or something as well. So
Yeah.
I think, Sharon, we have a lot to talk about.
We
So
do, and certainly some stories to share of people's experiences, because there is not one person on this planet that doesn't know someone who's been diagnosed with breast cancer. And so many times we just want to put our heads into the, like buried into the ground like an ostrich, because we think that, well, if we don't know, if we don't pay attention to it, it's okay, it's going to go away. But it's not. So it's so important, as you just said, to be our own health advocates. So, you start talking about lifestyle and mental. So mental, listen to me, I'm pretty mental, I'm saying, but.
that's another conversation for another week.
Yes. Anyway, continue.
Well, let's talk about lifestyle. I think one of the biggest things that women need to do is really tune into themselves and learn to start taking time for themselves, right? I think part of it is really listening to our needs. Sometimes we get into this rat race of what has to be done for everybody. And so we don't necessarily take that moment to kind of step back and look at the big picture. We talked about in the past conversations, we've talked about like the 5-minute morning routine. And I really would love people more than anything to ask themselves those 2 questions. And I'll repeat them again. What do I need from today, and how do I want to feel? Because it makes you think about what your needs are.
Yeah. And it's so important with that. How do I want to feel in the morning? Also doing that body scan of getting connected to ourselves. And, it's not a coincidence that we have these themes every month that we're unpacking, because it comes back to that awareness, to that self. And so if you start tuning in and taking notice, taking stock of what you're feeling and writing it down and connecting the dots and looking at patterns and habits, then you get so much more attuned to, like you said, what you need and what you want to get from the day.
I totally agree. And I think, your body is telling you something, right? So if you have aches or pains, like really understand where that's coming from.
Yeah. Yeah. It's funny that you say that about aches and pains, because I have so many clients who they think it's normal that they have certain aches and pains, or they have certain things or symptoms. They're like, oh, this is normal. This is just my body. But it's not normal. It's common. But there's no way that that's normal. Our bodies were meant to feel great, but we just don't even know what that means anymore. So really tuning into yourself is so important in all aspects, but certainly, for this month and even for the men, noticing the women in their lives of if there's even a change in how they're showing up and their behavior. When things happen emotionally, which I know you're going to touch on, it just kind of has this ripple effect throughout our whole body. And people can sense that more sometimes than we can because we're so caught up in it.
That's a really good point. People can sense it. People can see it because we're in it and we don't necessarily see what's going on. You know, personally, I get migraines periodically, but when you have a series of migraines, I've been a little stressed lately, I'll be honest. Um, Having a series of migraines is not normal. That's just not a normal thing. You should not be popping your migraine medicine or Excedrin migraine on a regular basis. So what is that? And I really want people to realize that stress does have negative effects, right? And so there's a system that's going on. Your body is a system and it's telling your body something. So, realizing where the pain is, right? So obviously migraine is in my head, but where is it happening? What is it telling me? And what can I do about it? And, just being able to quietly, for me, meditate a little bit longer in the morning. So I got up earlier the last few days to just have that, instead of a 3-minute meditation, I did a 10-minute meditation. Just kind of let me reset the tone for the day. And
Yeah.
I really suggest people do that. You can plug in that time to just kind of reset the situation.
Yeah, that's such a good point. And I think, especially like this month, Breast Cancer Awareness Month, amongst other things, because there's always so many different happenings during the month, and I've seen it when I've had conversations with friends who have had, they've lost moms to breast cancer who they didn't want to know, so they didn't do anything about it. And we look at it in such a fearful way. And as the fear strategist, right, there's ways to shift that mindset of the awareness, because when you have the information, and you're empowered with that information, then you can do something, you can feel stronger and not be as fearful
Right.
and advocate, right, as you were saying earlier. And I think that that's something that's still kind of some people are in that void where they get frozen, they get paralyzed from the fear.
It's an excellent point because that's where you really need to tune into the fear and lean into it and consciously make a choice to use it to empower you. Because listen, research is getting better, diagnosis is getting earlier. There's situations where the survival rate, things like that have really expanded so much more. And so you have to be an advocate and you have to be able to research and stuff like that. And so knowledge is power,
And you
you know?
have to be hopeful. It's you have a choice every day. The glass can be half full or half empty, right? You're 50-50,
Right.
pessimist, optimist. So it's so easy to go down that rabbit hole. And if we practice the muscle of in just like in putting some hope into ourselves, because we have the information, we have the great doctors, we have the good nutrition, we have the resources, then we can always have hope. And surrounding ourselves with people who are going to lift us up and be hopeful with us. I know we're going to talk about have some stories in the next weeks, but I just have to mention, I have one friend who was diagnosed with cancer, ovarian cancer, not breast cancer, ovarian cancer. And she didn't want to talk about it with people unless they just talked about good things, because her feeling was, if I keep bringing this up, all I'm doing is drawing energy to it.
Hmm.
And I'm doing what I have to do. And all I want is the positive support and love from people. And I think that, and she's, ovarian cancer is, it's definitely one of the more severe
Aggressive.
cancers,
Yeah.
right? She's great. I mean, knock on wood, she's doing amazing. So there's something to be said about the mind and infusing the love and the hope into it, because
Right.
that's what'll carry you.
Right. Yeah, that's true. That's amazing. That really is amazing. And I know we'll talk further about this too, but there's also, tools that you can use, right? And talking about breast cancer and self-exams and stuff like that. I mean, I'm horrible at doing that sort of thing. I'll be the first one to say that, but you should. Like, there's tools that you should use, and there's nothing wrong with doing it, and you have to do it. I mean, it's just one more step to listening to yourself. And if something that doesn't feel right, check it out.
Yeah. So I think for this week, it's really, getting people to start thinking about how they're looking at their health,
Right.
women and the men, right? Because listen, breast cancer affects men also.
It does.
They do. And we'll talk more about different ways and what to pay attention to in the future episodes. But for this week, if you or someone I think has breast cancer, what can you do? Think of ways of how you can show up, what you want from the day, and then how you can support that person and how you can be supported. And if not, and let's say thankfully you're healthy, knock on wood, is how do I stay healthy and how do I show up as my best self? And that is the overall arching message really of everything that we talk about, is coming up forth and standing in that power of hope and energy and love.
Couldn't say it better myself, Sharon. That's a great way to just unpack lunch. I think it's a great start to this whole month.
I agree. And as always, I love unpacking lunch with you, and one day we'll be able to do it in person.
I can't wait.
Now we've got Zoom. Until next week, have a great day, everybody.
Take care.